All right, so it's been a while, a little over 2 weeks, I believe. Um, 2 weeks yesterday, if I'm doing that right. I spoke to the camera on March 31st, which was a Monday, right? Yeah, April 1st. I the adventure began. Actually, no, I should back up. The adventure began at birth. It just didn't gain any momentum till the last year and a half or so. Um, and I'm going to probably give you enough of a synopsis here that you don't need to do any other video watching. But I did make a video back in September uh, when I had to go to Charleston for some tests. Um, sorry for my voice being a little weak. We'll get to that. Uh, so September 1st, April 1st, I that afternoon I headed down to Charleston, South Carolina, to MUSC, and um, Tuesday morning, nope, Wednesday morning, I had a battery of tests at Sean Jenkins Children's Hospital and Rutledge Tower Hospital, and then back to Sean Jenkins Children's Hospital. Why Children's Hospital? Because I was born with a defect in my heart, and most of my life, all of my life until the last couple of years, year and a half, it had been innocuous. It had not caused any problems. I've always been overweight. It really, the weight, I don't know that it played any factor, to be honest, but obviously doesn't help, and I'm working on it. And but I was athletic. I did endurance things. I did strength things, and never had an issue. Even in spite of the fact at one time I think I was in my mid-teens, being told to not do any heavy lifting, and then of course in my 20s I took up powerlifting as a hobby. So like I said, it was never problematic. Um, then I started having problems, and long story short, I got referred down to MUSC in Charleston. I'm very fortunate that MUSC pediatric cardiology is one of the top in the country. Depending on what list you look at, you'll see them anywhere from 1 to 4. So I'm going to say that means they're one of the top. And in September, they looked and looked and looked in different ways, and I had all kinds of scans and tests here, and that's when they said maybe we need to hand you off to the big boys down in Charleston. So I think there was a glitch in the system, and things may have gotten delayed a little bit from September till April. But surgery was scheduled for April 3rd. So April 2nd, we did all the testing, but in the meantime, or actually even before that, I knew the day before that the surgery had been bumped back a day. A patient coming in for surgery takes a back seat to any kind of emergencies they have with patients in-house. I get that. That's cool. I didn't, because I already had my hotel reservation, I didn't want to go back and forth. So I just stayed down there after the testing on Wednesday and enjoyed myself Thursday a little bit. Wednesday was actually kind of fun. I mean, the testing was nothing nothing really uncomfortable. The more uncomfortable things were done back in September. And the standpoint of having scans and x-rays and whatever in a children's hospital is that everything's geared towards kids to make them comfortable and relaxed and maybe put a smile on their face. And I got to tell you, even as a 54-year-old getting slid into a CT tunnel or tube and looking around at the Finding Nemo stickers, it was kind of cute. If you don't know, Finding Nemo has kind of a special place in my family. But anyway, let's save that for another day if I haven't already told you. So after enjoying myself Thursday, just kind of, I had stopped at the YMCA north of Charleston on the way down for a workout, so I decided Thursday I'd go back, and it was about a 30 or 40 minute, about 30-minute drive back, and I thought, well, it's a hell of a lot better than the hotel gym. So I maintained my workouts right up until the last day. So, and then I stopped at a pub down there where Spurs fans meet to watch Tottenham play. And unfortunately, it was a midweek day game, so I was there by myself, but I got to watch my team play and lose again. So, Friday morning, big day. Now, Sarah's parents came down too. They wanted me to not be alone for that. And Sarah was staying here to help take care of my father in cooperation with the caregiving team that the VA was supplementing. So that was a big weight off my chest, and no pun intended. And so I didn't really have any stress over my own personal situation until Walt's situation was made clear, and the plans were laid for him. And then it kind of hit me. It's like, damn, bro, you're about to have open heart surgery. So I probably didn't do myself any favors that last week or two when it comes to eating. I'm thinking I was probably in the upper 270s. I'm going to say like 278, give or take. Anyway, so the morning of the surgery rolls around. I have to be there at 5:30, and I barely got in bed and moving before I was out. Didn't know anything. I was gone to the world. Now, I'm going to give you a synopsis of what they do if you're not familiar. So they obviously cut you down the middle, and then they cut your sternum in half. I've had surgeries before where there's been bone cutting, and that's usually the worst part. They open your chest up. They inflate it with gases to open the cavity up some. They deflate your lungs, and they take your heart out of your body in the pericardium, the sac that holds the heart, and put you on a machine to keep your blood pumping and oxygenated and all that good stuff. They do what they do. So, what the defect that I was born with is called VSD, ventriculoseptal defect. It just means there's a hole in the wall between your two ventricles, the two lower portions, two lower chambers of your heart. I wish I had a visual to show you, but the problem with mine was it was very small, a very small hole, which caused a stronger amount of suction. That suction was near what they call the RVOT, right ventricle outflow tract. So it would be, I think that's your tricuspid valve, one of the heart valves that has 3 flaps to it, 3 overlapping flaps. And because the flaps or the outflow was so close to the hole, the reverse flow of blood was actually sucking one of those flaps open, so that my oxygenation was never full. It was inefficient. I was not getting adequate blood flow or oxygen into my blood. And so, according to the doctor, the surgery went very well. It took longer than expected. It was about a 6.5 hour surgery. They had a hard time even finding the hole. It was that small. So they patched the hole. They repaired the damage to the outflow tract, that little valve flap. And then, because my heart had been compensating for the inefficient blood flow and oxygenation, there had been some other issues that they wanted to clean up while they were in there. Now, my first big heart issue was back in 2014, and it arose again in 2024. So 10 years apart, I had ablations. That's what they do when you have an arrhythmic episode. Them not being entirely sure if the murmur or the congenital defect really had anything to do with the arrhythmia, they wanted to take a look while they were in there and do what they call a Mays procedure. No idea what Mays stands for. But so they did a Mays procedure as well, and then put me back together and sew me back up and bring me back to life. So if you're queasy about scars or anything like that, avert your eyes. I'll give you a quick look at my chest here. I think I will. Maybe I will. Hey, how are we going to do this? So that's my scar there. I haven't measured it yet. I'm going to say that's probably close to 8 inches maybe. I'm not sure. Anyway, so like I said, I went in, surgery started, or the anesthesia and everything started around 5:30 or 6. Let's just say 6. I woke up sometime in the wee hours of Saturday morning, or possibly really late Friday night. Pain was probably not what I expected, but they did have me on some IV pain meds and Dilaudid and Oxycontin, Codone. We don't do cotton. Oxycodone. And believe it or not, a muscle relaxer and Tylenol. In fact, Tylenol's really the only pain medicine I'm still taking at this point. I have some at my disposal if things were to get worse, but hopefully by now, fingers crossed, the pain is I'm on the downhill side of that. My mobility picked up pretty quickly. It was only a matter of 4 or 5 days maybe before I was allowed to get out of bed on my own and move around some in the hospital. I have a few things I can give credit for that. Probably most of all the friends and family and frankly strangers praying for this whole procedure. But on my end, alone, I have to say, do your squats, kids. Do your core work. Keep your legs and upper body, core, everything strong. Because after a surgery like this, you get a little lump right in here that you can't quite figure out what the hell is that lump. And then you find out it's where they've had to tie muscles back together. The admonition from physical therapy and occupational therapy is to stay in a tube. In other words, imagine you're in a big tube and you can't go out to the side or out too far in front with your arms. Keeping those elbows locked at your side is about it. Wish I had known that ahead of time. I might have made sure that my house was in, some of the things in my house were in a better position for me to do for myself. It's a hard thing. It's a humiliating thing to need so much help. Help in the bathroom, help with everything. So, yeah, every morning at 4:15, they'd come in and wake me up for x-rays and wait. I think the most alarming thing, I'm probably exaggerating that, but it was alarming, was to look at my hands and feet. The amount of fluid they pump into you and the amount of gas they pump into you puffs you up like a balloon. My hands and feet were swollen, legs were swollen beyond recognition to me. They didn't look like they belonged to me. At this point, the swelling's virtually gone. If there's any swelling left, I really can't. I can't see it. My ankles are back to them skinny little selves, and my weight, over the course of the last 6 days, maybe even longer than that, my weight has gone down about 5 pounds a day. Currently, I weigh. This morning, I think I was 250 something, 255. I really don't remember now. I'm blanking. Some of this blanking, I don't think so, but I was told a few things prior to surgery. There will be some brain fog. When they shut your body down for that long, some of it doesn't come back right away. I did struggle in the initial days after the surgery with finding some words, and Wordle wasn't real easy a few days. I took books with me, and I never touched them while I was there. I don't know why I thought I would read while I was there, but if you know me well, you know that I'd almost rather do anything. I'd almost rather listen to music than anything else. I did watch my Spurs play a couple of matches, and I listened to a lot of music. I'm very grateful for the care I got down there. It was wonderful. I'm beyond grateful for the help and the generosity of Sarah and her parents. They visited me twice a day, every day, got me anything I needed or wanted, including chapstick, which I'm not normally a chapstick guy, but having to sleep with a CPAP a couple nights to get your lungs functioning better again and get your oxygen levels back up did a number on my lips. I was biting big pieces of skin off my lips. They were so horribly chapped. You hear the roughness in my throat. It's better sometimes than others, but it's a matter of not only having however many tubes were down my throat, but also the reinflation of your lungs. Picture, if you will, a cluster of grapes, and that's somewhat what the alveoli inside your lungs look like. And imagine that you just smushed them all together and flattened them. And then that's what your lungs were like during this kind of procedure. And then they reinflate them. So the CPAP, I still have two, I call them my breathing toys, two respiratory tools here with me now that I'm still doing to try to just get my breathing and voice back. Really, they said talking was as good as anything. So what we're doing right now is therapeutic for me. So anyway, I really thought for a while that I was going to be discharged a little sooner, but I got discharged kind of on schedule to what they had initially told me, which was 7 days. So surgery was a Friday morning, and discharge was the next Friday afternoon. I kind of hate that the last 3 trips I've made to Charleston have not been to put my feet in the sand. And I know that at least one more trip will happen before I get to put my feet in the sand. The upside of having this surgery in Charleston is that I believe I was in the best location with the best doctors I could have ever asked for. The downside to having my surgery in Charleston is that's where at least one of my follow-up visits will be. And as of now, it's scheduled for next Monday. Sarah's parents are going to take me back down again so that Sarah can be here to help my father get ready and get to dialysis. So I'm on the upswing. My friend Smoke is taking care of cutting my grass, and Sarah and the VA caregivers are seeing to my father and me some at this point. I had really long hair, and I still do have really long hair. It got pretty damn knotted up back there, and Sarah's done her best to get it detangled and combed back out some, but I still may decide to just hack it off at some point. My beard, I did not anticipate that how much my beard grew in a week. I'm used to trimming it every week without thinking about it, and shaving down here 2 or 3 or 4 times a week, and I didn't do that. So the itching down here was driving me crazy, and then it kind of blended right into the itching on my chest. So between the incision healing, being itchy, and the hair on my chest regrowing, being itchy, I don't have too many shirts that are comfortable, which is why I'm sitting here in front of you without a shirt on. So it's been quite an interesting journey, to say the least. I was warned ahead of time that I would have emotion swings, and I have, and I've done well so far to not cry in front of you. I think most of us have probably seen those videos of someone who has just gotten a cochlear implant, and they hear their child's voice or their mother's voice or a dog bark for the first time. I had that experience. I got to hear my heartbeat normally for the first time in my life. I got to hear an unmurmured heartbeat, and it blew me away. And I'm grateful. I believe my long record of consistent exercise has given me a strong heart that helped me get through this. Uh, it's pretty weird to lay in bed or in my chair for now, and my heart is beating so strongly it feels like it's rocking my body. It's a comfort. And as anxious as I am to get back to some normalcy, it comes back slowly. I won't be able to drive for 2 to 3 months. It'll be months before I can lift anything over 5 or 10 pounds. I push it every now and then, and I often regret it. I'm inspired to make more changes, not because my heart surgery was anything to do with cholesterol or lipids and all those things. It's just I got a new heart and I kind of want to treat it a little better. So I had a buddy reach out to me, a man who's getting eaten up with cancer, reaches out to ask me what he can do for me. And he asked if I was ready for a chili cheeseburger or some chicken fingers. And I said, I don't think so right now, bud. But it won't be a bad idea to drop some more weight. Like I said, I'm down in the 250s now, so I'm heading in the right direction. I've worked on getting my normal liquid hydration back. If you know me, you know I drink an extraordinary amount of water, so I'm trying to get that back. I'm still on Lasix from the hospital to get the fluid that causes all the swelling out, so a lot of the fluid I'm drinking to try to rehydrate is going right back out. And not to be too gross about it, but damn does it stink. I thought Walt's dialysis pee stunk. Oh, Jesus. Anyway, sorry for the TMI. But anyway, so here we are. What? Almost 2 weeks, a week and a half out from surgery. I come out a few times a day, 3, 4, 5 times a day. Walk up and down the driveway until I feel like it's time to sit down. I actually got more than 5,000 steps yesterday, so I felt pretty good about that. Today, Sarah took me up to my doctor's office to get a prescription refilled for my Libre sensors, my continuous glucose monitor. And there was an insurance glitch, so I didn't get them. But they made some changes to my diabetes routine, which so far so good, which also is probably helped by the weight loss. I was right at that point weight-wise where if I had gone just a little lower, I would have seen a need to decrease my amount of insulin. So I'm well below that now, and I'm getting by on not only less of my long-lasting injectables, but they took away all of my mealtime insulin shots. So I was on 1 shot in the morning, long-lasting, actually a GLP-1. It's not considered an insulin, and then another shot every time I ate. So it might be 3, 4, 5 times a day I would have to take another shot, and then another long-lasting injectable, an insulin injectable at night. And so they took away those meal fast acting or short coverage, sometimes they called it, insulins, and just went up a little bit on my bedtime insulin. So that's nice. Less needles, the better. Oh, and speaking of needles, I kind of glossed over this part, I guess. I tried to not look, but I had more tubes and stuff coming out of me than I really wanted to process at the time. Drainage tubes and blah, 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 blah. And this thing about this big covering the incision area, wound vac, basically. And that was the last thing to come off. Second to last thing to come off or out. Because of the arrhythmia issues, the last thing to come out, I don't think you can see it anymore. No, I don't. They faded. Might have been right in here. There were AV wires, not audio video, atrial fibril ventricular, yeah, atrial ventricular wires, because they were monitoring my rhythm the whole time, and since it stayed good, other than couple teeny tiny little moments where I'd feel it and then it was gone. So those were the last two things, and that was kind of the determining factor. Once they pulled those, they wanted a 24-hour observation. So Thursday morning, they came in, laid me flat, which was, laying flat those first few days was torturous. But by then, by Friday, it was okay, or Thursday. And so they pulled those wires. They explained prior to pulling those wires where I may feel pain when they did it. Well, they pulled them and I really didn't have any pain. But because of the potential for any kind of internal bleeding or anything like that, they wanted me to lay perfectly still for at least 2 hours. And at that point, laying perfectly still was easy. So they did that. And then Friday morning, the same routine. They came in at 4:15 for x-rays and weight. They came in to do another echo, just to get a good look, make sure everything inside was looking okay. And Friday was my discharge. I hope you never need to go to MUSC for anything. I hope you never have to have a child there for anything. But I can't tell you how great they were. I really can't. My only complaint about anyone that worked with me while I was in there is a very superficial and petty complaint. Okay, so there was this kind of running joke about how many nurses and nursing assistants and physician's assistants and all nurse practitioners, all that had a hard CH or a K sound to the beginning of their name, and it was Chloe and Kat and Kate and Kristen and Kendall and Crystal and Kelsha, and it just kind of went on, and it ended up being kind of funny after a while. But Cam was a guy, and he came in, and it's just, I'm judging a book by its cover. Cam looked like a player. Like Cam was, he was there for the nurses. And he was dressed nicely with a very nice bracelet, and his hair was just right, and he had a cool coat on, but he had a little too much cologne. It was a nice smell, but it was just a little much. So if that's my only complaint, no biggie. Yeah, everybody was great. So for those of you who knew or didn't know, that's what happened. Those of you who've reached out to me or Sarah or anybody checking in on me, I really do appreciate it. My friends have truly shown themselves, and I'm very grateful. So I don't know how long it'll be before I feel the need to give you another update, but just kind of want to let you know I'm doing okay, and I'll be swinging kettlebells again in no time. Thanks for watching.